to my YouTube channel. So friends, in this video today we are going to discuss about the topic, basically what exactly the drugs used in the general anesthesia. There are various drugs used in the general anesthesia. We will study one by one with the help of examples as well. I have created this video with the help of notes as well, so that it will help you to understand this topic very well. So these are the below mentioned drugs like intravenous, inhalation, sedatives, analgesics and many more. These are the common drugs which are generally used in the general anesthesia. So friends, without delaying anymore, let's move further. But before that, if you have not subscribed my channel, please subscribe it and click on the bell icon. Moreover, like and share and comment also. Okay friends, so let's start with the topic. First slide, that is a intravenous anesthetic drug. So intravenous anesthetic drug, this is the first category of the general anesthesia. So these intravenous anesthetics are the unique type of drugs that induce the anesthesia rapidly as they quickly achieve high concentration in the central nervous system. So in this slide here it is mentioned that intravenous anesthetics are generally given inside the veins. Intra means within, venous means veins. So these are the type of anesthetic drugs which are generally given in the veins, and these are the unique type of drugs which create the basically quickly achieve the high concentration in our central nervous system. It creates the very good effect and quick effect in the central nervous system. I hope that it is clear that intravenous anesthetic drugs are those which are given in the venous, or they quickly achieve the high concentration in our central nervous system and create its effect. If we talk about the examples of the intravenous anesthetic, that is the etomidate, lipura, ketamine, propofol, and last is the propofol, lipura, thiopental sodium desflurane. I hope this topic is cleared about the intravenous anesthetic. Now we move to the next slide, and that is the inhalation anesthetic drugs. These are the most common drug which is used in general anesthesia. As its name suggests, inhalation anesthetic means these drugs can be taken by patient only by inhaling the smell of these drugs. With the help of mouth and with the help of nose, we can inhale these anesthetic drugs. So these drugs used for the induction and maintenance of the general anesthesia in the operating room. So what is the purpose of inhalation drugs? These are the drugs which is used for the induction purpose and for the maintenance of the general anesthesia. And these are taken by the help of mouth and nose by inhaling the smell of these drugs. If we look at the example side, like what exactly the inhalation anesthetics drugs example. So first is the enflurane, halothane, isoflurane. These are in the liquid form, but these drugs can be taken by only inhaling the smell of these drugs. So enflurane, halothane, isoflurane, evoflurane and atropine. I hope friends this slide is also clear about the topic inhalation anesthetic. Now we move to the next slide, and that is the antimuscarinic drugs. Antimuscarinic drugs are those drugs basically treating for the bronchoconstriction and excessive salivation, motion sickness. You know friends, bronchoconstriction means when there is some problem occur in the bronchus, so that the bronchus get constricted. This is the bronchoconstriction. So in this condition we take the antimuscarinic drug, or moreover in other conditions such as the excessive salivation, once the saliva comes in more quantity in our mouth, that time also we use these drugs. Moreover in the motion sickness and intestinal spasticity, diarrhea and urea incontinence. In this condition also we use these drugs. If we look at the example of these drugs, so that is a glycopyrronium bromide, atropine, scopolamine, glycopyrronium neostigmine, tropicamide, hyoscine hydrobromide diazepam. These are the general drugs which comes under the category of the antimuscarinic drugs. Friends, if you have any kind of doubt, you just mention in the comment box. I will clear that doubt. So, okay, let's move further to the next slide, and that is the sedatives and the analgesic drugs. So, what are the sedative and analgesic drugs? Sedation drug slows down the brain activity. Basically, the purpose of sedative drug is to slow down the brain activity. Analgesic drug used to get relief from the pain. Once the anesthesia is given to the patient, so these drugs are mandatory to give to the patient so that it slows down the brain activity of the patient. Moreover, it helps to reduce the get relief from the pain side. So analgesic drugs also play a vital role in we get relieving from the pain. If you look at the example, like what exactly the drugs comes under the sedative and the analgesic. So under the sedative drugs, lorazepam, midazolam, diazepam. These three drugs comes under the sedative category. If we look at the analgesic, so fentanyl, it is most like popular one, you can say. Fentanyl drug and the meperidine. So these two drugs, other drugs are also come under the category of analgesic. But as of now, I have only mentioned two, that is the fentanyl and meperidine. Okay, friends, look at this drug, that is a benzodiazepines and barbiturates. This is a kind of drug which is the combination with the analgesic. It is a combination of the sedative drug and the analgesic drug. So if the question comes in the exam that what is the combination of the drug like sedative and analgesic drug combination. So this is the answer that benzodiazepam and barbiturates is a drug which is it is a combination of the sedative drug and the analgesic drug. I hope it is clear that what exactly the sedative drug and the analgesic drug. Okay friends, so let's move to the next slide, and that is the anxiolytic and neuroleptic drugs. Anxiolytic and neuroleptic drugs. So the purpose of these drugs is to treat the anxiety before the surgery and to treat the sleep disorder and seizures during the surgery. These drugs play also a very vital role because during the surgery, what happened before the surgery, what happened, the patient gets too much anxiety. They feel that yeah, what will happen in the surgery. So generally, like it's a matter of the fearness. So that's why, like just to reduce the anxiety of the patient, anxiolytic drugs are given, and the neuroleptic drugs are given basically to get relief from the seizures problem, seizures during the surgery. Sometimes some patients feel the seizures, suffer from the seizures. So just to reduce this seizure problem, neuroleptic drug is used. So if you look at the example side, what exactly the drug can come under the anxiolytic and neuroleptic? So that is a promethazine, primidone, thiopental and temazepam. So these are the four drugs I have mentioned which come under the category of anxiolytic drug and the neuroleptic drug. Friends, again I am telling that if you have any kind of doubt, please mention in the comment box. I will let you know. Also mention in the comment box that what exactly the drug basically you have liked it. Let's move to the next slide now. That is a non-opioid analgesic. If we talk about the topic of the analgesic, so this is divided into the two categories. That is a non-opioid analgesic and another is the opioid analgesic. The purpose of analgesic is to get relief from the pain. Or now in this slide we are talking about the non-opioid analgesic. So these are the basically drugs which are used to get relief from pain. But what kind of pain? The pain from mild to moderate and acute to chronic means the mild the pain which is the if the patient is suffering from a mild to moderate pain or acute basically chronic pain, acute pain, in any kind of pain we can give the non-opioid analgesic. But generally we give these drugs for the headache, muscular ache and pain of the inflammatory origin. So for the common pain, we use the non-opioid drugs such as headache, muscular ache and pain of the inflammatory origin. If you look at the example side, So paracetamol, aspirin, glucocorticosteroids, other NSAIDs. NSAIDs like non-steroidal anti-inflammatory drugs, including the ibuprofen, diclofenac and naproxen. So these are the drugs which come under the category of the non-opioid analgesics. Friends, let's move to the next slide, that is a opioid analgesics. In previous slide we have seen the non-opioid analgesics. So here we are going to study about opioid analgesics. So this is a kind of drug which are administered to get relief from the severe type of pain. If the patient is suffering from a severe pain during the anesthesia, during the surgery, that time we use the opioid analgesics. For example, in case of the fracture, burn, renal colic and coronary occlusion. So these are the problems in which the patient suffers from a lot of suffers from a too much pain. That time we have to use the opioid analgesic. If we look at the example side, so fentanyl CD patches, morphine CD, pethidine CD, remifentanil, atracurium, cispacurium, mivacurium and pancurium. So these are the drugs which comes under the category of the opioid analgesics. In this video we are not going to discuss about the concentration of the drugs. So only our focus is to discuss about what exactly the drugs come under the category of opioid. So friends, this is the next slide of the muscle relaxant drug. These drugs are used to get relief from the muscle spasm by blocking the nerve impulses to the muscles. So during the surgery, what happens? The patient suffers from a muscle spasm problem. So that time muscle relaxants are given to get relief from the muscle spasm. And how does this muscle relaxant work? It blocks the nerve impulses to the muscles. So whatever the nerve impulses are present below the nerve, below the muscles, so these muscle relaxants block the nerve impulses to the muscles. If we look at the examples of the muscle relaxants, so that is a rocuronium, suxamethonium, vecuronium, adromorphium and neostigmine, doxapram or flusamazine. So these are the drugs which comes under the category of the muscle relaxant. So friends, last category of the drug, that is the anticholinesterase drugs. If we look at the use of these drugs, so these drugs increase the amount of acetylcholine at the neuromuscular junction. Only focus on this thing, that it increase the amount of acetylcholine in the neuromuscular junction. So what will happen then? Overcoming the effect of any residual neuromuscular blocking agent. Now I tell you that during the general anesthesia, we give some drugs which basically what does do? They create a neuromuscular blocking agent. It blocks the neuromuscular. So during the anesthesia, generally we give the neuromuscular agent so that the surgery can go smoothly. So at the end of the surgery, when the operation is done properly, that time this anticholinesterase drugs are given so that the overcoming the effect of any residual neuromuscular blocking agent. Whatever drugs we have given for the neuromuscular blocking agent, so to overcome the effect of residual neuromuscular blocking agent, we have to use the anticholinesterase drugs. And how does it work? It increases the level of the acetylcholine at the neuromuscular junction. In this way, it overcomes the effect of any residual neuromuscular blocking agent. So if we look at the example of the anticholinesterase drugs, so that is a succinylcholine, next is a cyclostigmine, last is a neostigmine. So these are the three drugs which comes under the category of the anticholinesterase drugs. I hope friends the topic is clear now. So again, like whatever the doubt you have, you just mention in the comment box, or whatever the new videos you are expecting from my side, also let me know in the comment box. So friends, we are going to end this topic here. Thank you so much for watching this video. Please do not forget to subscribe my channel. Also like and share it, comment also. Motivate me by subscribing my channel. Thank you.